A very good afternoon to one and all. I am Arpita from the IGCP group, today's moderator for the session on topic human milk banking. Now, human milk banking, it refers to the systematic collection, screening, processing, storage, and distribution of human breast milk donated by lactate mothers. This milk is typically intended for infants who cannot access their mother's milk, particularly premature, low birth weight, or if they are critically ill neonates. So this is a something very sensitive topic, and yes, we should keep on speaking about this. Today we have with us someone very eminent and very prominent who can speak on this topic and aware us on this. So it's an honor for me to welcome Professor Dr. T. Usharani ma'am. Ma'am is a professor, former superintendent and HOD of Pediatrics Department at Nilofer Hospital and Osmania Medical College, Hyderabad, Telangana. Ma'am, now I would request you to please start with your presentation. Post that, we'll take the questions from audiences. Over to you, ma'am.
Thank you. Thank you, Arpita. Thank you for the kind introduction. Very good afternoon to you all. Now, it's a privilege for me to address this gathering on human milk banking as a part of Newborn Week observance. So, as we all know, third week of November is celebrated as Newborn Week all over the world. So, we all know newborns are the most vulnerable group. And if you look at the statistics, every country is struggling to reduce the neonatal mortality, especially more so in developing countries. So among the under 5, so the major chunk is in the newborn period. The mortality is more in the newborn period. And we all know the single most effective intervention to reduce the newborn deaths is breast milk. So breast milk is best for the baby, and it provides with the healthiest start to life. And it has innumerable benefits, not only in optimizing the growth and development of newborn, but also several long-term benefits are there. So if a baby is fed on breast milk within the first hour, which is called golden hour, and is maintained on exclusive breastfeeding for 6 months and continued with breastfeeding along with the complementary feeding for the first 2 years of life, that gives the best foundation to life in terms of maintaining both physical, mental, emotional health. Not only that, it also has immense benefits in preventing long-term diseases like diabetes. Even if the baby is exclusively breastfed for 6 months, then even it has advantages once the baby is grown into adulthood. There is lesser risk of allergies, lesser risk of asthma, lesser risk of cancers, etc., etc. And also obesity problem is also less in breast milk fed babies compared to formula fed babies. So we all know breastfeeding is the best for the baby. But still, if you look at the statistics of what are the percentages of babies who are fed with exclusive breastfeeding, and what percent of babies are fed within the golden hour, that is first hour of feeding, they are really disheartening. Not even 50% of the babies are fed in the first hour or exclusively fed in the first 6 months. So we need to promote breastfeeding practices. And there are some situations where a baby cannot be fed directly with the mother's milk. So some unfortunate circumstances, like if mother dies of some illness, or if mother is very sick and admitted in the hospital, or if the baby is unable to feed either because of prematurity or some sickness and admitted in neonatal intensive care unit, in such cases direct breastfeeding may not be possible. So in such cases, the best second option would be human milk banking. So in this next 20 minutes, we will I'll take you through overview of human milk banking. What is the history? What are the guidelines by the Ministry of Health and Family Welfare, Government of India? And what are the processes which exactly happen in the human milk bank? And what are the advantages of human milk, donor human milk, compared to formula milk? So if you look at the mythology, human milk banking concept is not new to us actually. If you look in mythological age also, we had, and in childhood we have read tales of Lord Krishna. Lord Krishna was fed by Yashoda, who acted as a wet nurse, though she was not his biological mother. So the concept of donor human milk has started from Puranas. So there are several advantages of donor human milk. It reduces the risk of sepsis, necrotizing enterocolitis. The babies will have better tolerance to feeds, and also they provide life-saving support to premature babies, and they reduce the length of stay in NICU, and also there is cost saving. So the first milk bank in the world is set up at Vienna in 1909, as early as 1909. But unfortunately, later, because of the scare of HIV and getting other infections, somehow the milk banking concept has not picked up well till 1930s and 40s. So in 1930s and 40s, again, USA and Europe, and also in several other countries, they have started setting up milk banks. And the best success story of human milk banking is, we can take the example of Brazil. Brazil is the country which has more than 200 human milk banks, and it has the world's largest, most effective system of human milk banking. And Brazil has shown that with human milk banking and with good newborn care, there has been 73% decline in infant mortality over the past decades. And even survival beyond the discharge, even after discharge from the intensive care units, the survival has improved. It has reduced the under 5 mortality by 2/3. And in 2015, nearly for 4,17,000 children have received, neonates have received donor human milk. And also they also have supporting programs like Social Mothers Program. So we can take Brazil as the best example for a successful nationalized comprehensive human milk banking program. If you look at the Indian scenario, the first human milk bank in India was set up 80 years after the first milk bank was set up in Vienna. So Dr. Armida Fernandez is a pediatrician from Sion Hospital, Mumbai, who started the first milk bank in Asia. This is the first milk bank in Asia, and they have shown that this donor human milk has improved the survival of premature and low birth weight babies. But in spite of the success of this milk bank, not many banks were set up. In milk banks were set up till 2005. Only after 2005, from 2005 to 2015, if you look, there are nearly 50 milk banks. If you look at the statistics, more than 2.7 million newborns are born in India every year, and we have only 50 milk banks. So there is a huge gap. There is a huge gap in the demand and supply of donor human milk in India. So we need to integrate human milk banking system with other components of newborn care. Then only we would be able to provide exclusive human milk to all sick, premature, and low birth weight babies. So this is a repetition. So coming to the
sorry,
guide.
continuous noise
Yes.
coming.
Is it so?
There's a continuous
Yeah,
noise.
1 minute. 1 minute.
Yeah, ma'am.
I think WhatsApp is open. Close the WhatsApp. Even now?
No, it's not coming. Please continue.
Okay, sorry for the interruption. So now, realizing the importance of human milk banking, our government of India had set up some guidelines. Actually, the true term which is to be used for human milk bank is Comprehensive Lactation Management Center, because it is just not the place where milk is stored and processed, but also the responsibility of the milk bank is to promote breastfeeding practices, not only in the milk bank but also in the postnatal wards and wherever delivery takes place. So government of India has released guidelines in 2017, and with an aim to start breast milk banks or comprehensive lactation management centers, which are called CLMCs. So the aim is to set up CLMCs in all tertiary care in medical colleges which have attached tertiary hospitals where newborn intensive care units are there. So ultimately, the government wants to expand this network of human milk banks to every place where deliveries take place, where labor rooms are there, where newborns are born. So this is a center which has facilities for collection, screening, processing, storage and dispensing of donated human milk for babies who do not have access to their own mother's milk. So if you look at this picture, so this milk bank, this is the CLMC, that is Comprehensive Lactation Management Center. So its duty is not only to collect the milk from the peripheral centers where mothers deliver their babies and those who have in excess of after meeting the demands of their babies, they donate milk. So all the milk is collected and processed here and is dispensed to babies who are admitted in the neonatal intensive care units. So not only this, but the other responsibilities of CLMCs are promoting breastfeeding counseling to antenatal mothers, starting breastfeeding within the first hour, whether it is a normal delivery or cesarean section. Feeding should be started within the first hour as soon as possible, immediately after the umbilical cord is cut. The baby has to be placed in between the breasts of the baby on mother's in between the breasts of the mother on the chest. So that skin to skin contact, the first ever skin to skin contact, helps in promoting breastfeeding. It enhances the emotional bonding and also helps in maintaining the temperature. The baby who is coming out from a warm atmosphere in the mother's womb to the outside cool temperatures. So to maintain temperature of the baby, the skin to skin contact with the mother, it helps in maintaining the temperature. And not only that, mother's breath stimulates the baby's breath. The up and down movements of the mother's chest, they stimulate the breathing movements of the baby and prevent apnea in the baby. So again, on-demand feeding and also whatever, so though breastfeeding is natural, every mother has some doubt on attachment, how to hold the baby. So all this kind of lactation support, with the minimal support, we can promote. So immediately after birth, if we can help the mother to get the baby attached to the breast, that will go a long way in success of lactation. Similarly, a small low birth weight babies and premature babies, they should be nurtured with kangaroo mother care. So kangaroo mother care, the term has been started because if you look at the mother kangaroo in Australian animal, the baby kangaroo is peanut size when it is born. So mother kangaroo nurtures the baby in the pouch attached to the abdomen. So till the baby grows. So similarly, the kangaroo mother care, if the baby is kept naked on the mother's chest and it is wrapped on the backside, then this is called as kangaroo mother care. The mother acts as a natural incubator in promoting temperature maintenance as well as promotion of breastfeeding. So CLMC has all these responsibilities. So if you look at where should it be located, human milk bank? So ideally a comprehensive lactation management center, that is CLMC or human milk bank, both are used synonymously. It should be in close proximity to neonatal units or postnatal wards or well baby clinics. So studies have shown that wherever human milk bank is there near neonatal unit, the exclusive breastfeeding rate at discharge and also breastfeeding rate, any breastfeeding, whether it is exclusive or 1 year breastfeeding, all the breastfeeding rates are higher in NICUs where human milk banks are located. And also formula feed is much lower in NICUs where human milk banks are available. Then how do we select the donors? So the process in the milk bank is the donor mothers come to the milk bank. The donors are selected and screened and these mothers are registered. The mothers express their breast milk and to prevent spread of infection, this milk is stored and then pasteurized. And after pasteurization, milk is screened again with cultures to see whether there are any infections. And once it is ensured that the milk is free from infection, Then depending on the need of the babies, the milk is dispensed. So this is a general flow. So the first step is the mother comes to the milk bank and the donors to be selected. Only healthy donors are selected. So mother should be screen. So we have to take the history to see whether whether the mother has any sickness, any fever, and are there any chronic illnesses by taking good history and physical examination. And also we have to ensure that her baby's needs are met. Then only the excess milk mother can donate to the milk bank. And always breast milk donation should be voluntary. We should not give any incentive. So it should not be commercialized. No money, no incentive should be given to the mothers because it should not be commercialized. So what there are some exclusion criteria. So our main aim is to prevent spread of infection from mother to baby. So for that we need to ensure that mother has not taken any blood transfusion or not received any organ transplant in the last 1 year. Similarly, those who have permanent tattoos in the last 1 year, they're excluded. If a mother is alcoholic or a smoker, chronic smoker, those mothers should be excluded. Similarly, if a mother has some infections like HIV or active tuberculosis or hepatitis B and C, then those mothers are excluded. They should not be allowed to donate. If a mother has some leukemia or lymphoma and is being treated with chemotherapy agents, or if the mother is on some teratogenic drugs or drugs which are harmful to the baby, then those mothers should not be allowed to donate milk in the milk bank. So if antenatal tests, like most of the mothers, they undergo HIV, HbA1c testing during the pregnancy. If those reports are there, we need not have to repeat the test. But if the test reports are more than 6 months, then we need to do the testing for HIV 1 and 2, hepatitis B, and also VDRL testing for syphilis. Hepatitis C is optional. Some milk banks, it depends upon each milk bank's SOP. So hepatitis C is optional. Then how do we collect? Once a mothers are screened, donor mothers are identified. So registration process is done and they are taken to the milk expression area where electrical breast milk pumps are put up. There are two varieties of breast pumps, double pumps and single pumps. So always double pumping is better in milk banks because milk is drawn quickly within 10 to 15 minutes expression can be finished. And also if both the breasts are simultaneously pumped, the prolactin reflex will be higher because once there is suction, the prolactin reflex will be stimulated. If both the breasts are pumped simultaneously, the reflex will be stronger and more milk will be produced. And the milk which is dripped from the other breast, if one side baby is fed or one side pumped, the drip milk from the other breast is inferior in nutritional quantity. It has a lower caloric value and lower fat and is not suitable for donation. So always for storing the milk, we need to use BPA free, that is bisphenol A free. BPA is supposed to be associated with risk of cancer. So any plastic container which is used for storage milk should be BPA free container. And this milk which is expressed from the donor mothers is stored in minus 20 degrees. It can be stored up to 3 months. So after storing, the milk is pooled before pasteurization. We should not take it directly from minus 20 and put it into the pasteurizer. Instead, you need to thaw it. So for 24 hours, you need to keep this frozen milk in a refrigerator at 4 degrees centigrade and slowly allow the milk to thaw. After this, the milk is pooled. Milk from 3 mothers is pooled into a conical flask and then it is put up for pasteurization. Pasteurization is a Holder method is used in most of the milk banks. In this method, the milk is heated and till 6 to 2.5 degrees and it is held at this temperature for 30 minutes. So after half an hour, the temperature is suddenly reduced. So this way what happens is this will kill the bacteria, but at the same time, this will minimize the heat damage to whatever nutrients which are present in the human milk. So after pasteurization, so what are the colony counts? What are the bacteriological count which can be allowed? So before pasteurization, if a milk has Staphylococcus aureus colony count of more than 10 to the power of 4, then you have to discard that milk. Other microbes are accepted because anyway we'll be pasteurizing. After pasteurization, when each milk bottle is again a sample is cultured, if any bacteria growth is found, then that milk is discarded. So after pasteurization, the milk should be free from all microbial agents. So after pasteurization, the milk can be stored in deep freezer at minus 20 degrees up to 6 months. So pre-pasteurization, we can store at minus 20 for 3 months. After pasteurization, it can be stored for 6 months. And once we get an indent from the neonatal units for dispensing milk, so prior to that, we need to thaw the milk in a refrigerator at 4 degrees centigrade for 24 hours. Then it should be dispensed in a first in and first out basis. So the oldest milk is dispensed first, then the recently expressed milk. Then who are the recipients? So each milk bank will have a protocol depending upon their load of newborns. Suppose our Nilafar hospital has a load of nearly 300 to 350 babies. So usually among the newborns, 30% are low birth weight. So as we have a very heavy load, we would not be able to provide human donor milk to all sick babies. So we have prioritized. So most of the babies below 1.5 kg, because they are at risk of necrotizing enterocolitis, they should get the donor human milk on priority. So premature babies, especially infants with a birth weight below 1.5 kg, so they should receive. Similarly, infants with gastrointestinal anomalies who undergo gastrointestinal surgery leading to short bowel syndrome. And if the mother is temporarily unable to nourish her infant, so the mother is in ICU or hospitalized in a faraway place, then those babies should receive donor human milk. Similarly, when you are weaning them from parental nutrition, that time also babies should get donor human milk. So this is to summarize the flow in human milk bank. The mother enters the milk bank, and then donor is screened. Once it is ensured that she is free of infection, she is registered. Milk is expressed using breast milk pump, and it is transported, and it is kept at minus 20 degrees for 3 months. It can be stored for 3 months. Then it is thawed, pulled, and pasteurized to make it free from infections. And after pasteurization, again, culture is done to rule out bacterial infection. And if it is free from infection, it is stored in the freezer, and then it is dispensed to the babies. So this is the flow in a human milk bank. Coming to what are the benefits? What are the benefits of donor human milk bank? There are a lot of studies which are done on donor human milk banks in premature and low birth weight babies. So in formula versus donor milk, these two are the studies which were done. And it has shown that human milk feeding, whether mother's own milk or donor human milk, it reduces the necrotizing. So NEC, that is necrotizing enterocolitis, is a fatal infection which occurs in premature babies. So the risk can be reduced by 79% if donor human milk is used. Similarly, in another more than 1,000 units of 11 trials, when formula feeding increased the risk of NEC. Coming to the risk of sepsis. So the risk of late onset sepsis in babies who are fed with donor human milk is reduced by 19% in the first 28 days compared to formula fed babies. And also the retinopathy of prematurity is another entity which can cause blindness in premature babies. So if the babies are fed on donor human milk or direct breast milk, it is associated with lower rates of severe ROP compared to formula fed babies. Similarly, the length of stay, risk of complications are much less in babies who are fed with donor human milk. And even after discharge, the hospital readmission rates are quite less in human milk fed babies compared to formula fed babies. Not only this, long-term benefits are there is improved greater white matter, brain volume is higher, And there are significantly higher score for mental, motor, and behavioral ratings in human milk fed babies compared to formula fed babies. And also in later childhood and adulthood, babies who have fed human milk have shown to have lower rates of metabolic syndrome. So this metabolic syndrome puts the babies at higher risk of diabetes, obesity, atherosclerotic disease in later childhood. So this risk is much lesser in human milk fed babies compared to formula fed babies. So compared to our experience, coming to our experience with Milk Bank, so I work in Nilofer Hospital, which is affiliated to Usmania Medical College. It is the biggest maternal and child hospital in South Asia. So we have a bed capacity of nearly 1,500 units, and our newborn unit has 4 units, and our load is on any day, given day 300 to 350 newborns are admitted. So in 2017, milk bank, human milk bank has been set up in a private public mode, PPP mode, with a Sushena Health Foundation and Government of Telangana together. So that time, Srimati Anupriya Patel, who is a union minister, had come on that day to inaugurate the milk bank. And this is a team of our milk bank. He's Dr. Santosh, who is the director of Sushena Health Foundation, who has who is the co-founder in this for this milk bank. This is called Nilofer Dhatri Milk Bank. And these are the counselors and the manager and doctors, then one medical officer. All this is a team of human milk bank in Nilofer Hospital. And in 2017 October, when my first milk was dispensed. So this is our neonatal unit, and I was also there when first milk was dispensed to one preterm baby. And these are the counselors from our human milk bank who help the mothers in promoting breastfeed. This is the kangaroo mother care, where babies are kept in skin to skin contact with the mothers. So these are all small preterm babies. So this helps in promoting breastfeeding and also maintaining temperature. So this is how reports are maintained weekly and monthly. This is in 2017. If you see, initially when it was set up in October 17, in a month, around 188 mothers visited the milk bank. But gradually it increased, and within a period of less than a year, 800 mothers were visiting. And this year, if you see, this has doubled. Nearly 1,600 to 1,700 mothers are visiting. And the milk expressed per month is more than 52,000 ml, that is more than 5 liters. So even now, this volume also had increased drastically in the last 7 years, and thousands of babies have benefited. Thousands of premature, low birth weight, and sick babies have benefited from this human milk bank. And this is one example. So this is a baby who was admitted, was preterm, and at the admission, the weight was less than 1 kilo. So this baby was in our NICU for 45 days for respiratory support and other treatments. And throughout the period, the baby was fed with human milk. And at discharge also, mother was also expressing. And at the time of discharge, mother was directly feeding the baby and continued to feed. At 4 months when she came for follow-up, this is the baby. You can see she was so healthy and picked up weight. And then the parents named the baby after this milk bank as baby Dhatri. So in the name of milk bank, they named the baby as baby Dhatri. So there are so many other such stories, and so many people from other parts of the country, they come here to visit our milk bank so that they can set up similar ones in their places. Even state government through National Health Mission is trying to establish, this is the process of establishing lactation support centers in many of the hospitals across the state. And these centers, which are there in hospitals other than medical college, they act as satellite centers. They collect the milk and transport it cold chain to tertiary care hospitals, where full-fledged comprehensive lactation management centers are there. So, and from satellites, and this milk is stored here, processed, and again dispensed to the babies of all collection centers. Thank you, and with these words, Arpita.
Yes, ma'am. Thank you, ma'am. Thank you so much for this beautiful and very informative PPT, I must say. And ma'am, we have received a few questions. Should I take them up?
Yeah.
Ma'am, the first question is based on your experience, how has the introduction of human milk banks impacted the health outcomes of preterm and low birth weight infants in your hospital?
Definitely, the survival has improved after starting Human Milk Bank. We are able to provide because ours being a referral hospital, many of the referrals come from not only other districts from other district but also from other states. We get referrals from Andhra, we get from Maharashtra, all neighboring. So mothers are kept there only. If mother undergoes section, the only baby is brought in an ambulance with respiratory support here, and we are able to provide exclusive human donor milk to these babies, and survivals have definitely improved. Mainly, we could see the benefit in terms of reduction in necrotizing enterocolitis.
Thank you
Yeah.
so much, ma'am, for sharing this information. Moving on to the next question. I think it's from a pediatrician. So, how can we play a pivotal role in educating parents and caregivers about the importance of human milk banks?
Yes, actually, the counseling, anyway, we do antenatal counseling for promotion of breastfeeding. So that itself encourages the human milk bank indirectly. So all mothers who come for antenatal checkups, we should start promoting breastfeeding from antenatal period itself. So the mothers are sensitized regarding the importance of breast milk. So, in the unfortunate instance where mothers are unable to feed, then they will be counseled after delivery, and they can take the help of donor human milk.
Right, ma'am. The next question is, what are the current challenges that you face, ma'am, in promoting human milk banking, especially in your state, Telangana?
Main problem is sustenance. Actually, being a government hospital, uh, the initial setting up of any unit or setting up of a machine is easier in a government sector. But sustaining the human resource and sustaining the recurring expenditure is a challenge. For example, in our own milk bank, we had an MOU for 4 years. So they want now MOU is ended, and they're asking us to take over the bank, but we are little apprehensive because they are there. We are getting continuous human resource, but in a government sector, most of the employees which we are taking now are on contract basis. So, like special newborn care units, also they're employing contract. So, on contract basis, if we take counselors and medical officers, how long they'll sustain? That is one problem. And recurring expenditure is huge in terms of disposables and also cultures. So, those are the challenges to maintain a human milk bank. And also, there should be constant power supply. So if there is interruption in the power supply, the milk gets spoiled, and also there are chances of infection, contamination. So all the persons who work in the human milk bank should be aware of these quality maintenance practices, hand washing, infection, maintaining infection-free environment. So these are the main challenges: uninterrupted power supply, and also maintaining infection-free environment. These are the main challenges in maintaining a milk bank.
Right, ma'am. Thank you so much. We have one last query. Um, Ma'am, what policies or strategies would you recommend to improve the awareness and accessibility of human milk banking service at both community and healthcare levels?
At healthcare levels, of course, what we are doing now, definitely for we are educating the professionals, so through newborn week. So these kind of awareness programs should not be restricted only for during the weeks like newborn week or breastfeeding week, but throughout the year, and also introducing it in the curriculum, in the undergraduate and postgraduate curriculum, which we are already doing in pediatric curriculum. In the PG level, human milk banking has been introduced, and also we post our PGs in the human milk bank. So from the undergraduate curriculum, if we include this, all professionals will be aware. And at a community level, all Anganwadi workers, because Asha health workers they play a key role in educating the communities. So if we can conduct orientation sessions to all Asha workers, they are the best people to convey this message to the field level and to the benefit that will benefit the mothers.
Right, ma'am. Ma'am, this was the last question for today's session. So before concluding, ma'am, I would like to express my heartfelt gratitude to you and the perspective that you have shared in on this like very critical topic, and it will be a huge contributing factor for awareness and improving the care practices for vulnerable infants. I'm really sure that those who have attended this session, they have been benefited and they have gained much knowledge about this topic. So, ma'am, thank you once again for putting your effort in
Thank
making
you.
this.
Thank you so much for patient listening. Thank you.
Ma'am. Thank you so much, ma'am. Thank you. Thank you all for attending the session. We are concluding it for today. Thank you all. Have a good day. Have a good day, ma'am. Thank you.
Thank you.